Health is one of the most critical factors towards living a good and happy life. Everyone wants themselves and those around them to have the best health possible. Health can be affected by many variables that relate to different factors of your life. The neighborhood you live in, the place you work, the food you have access to, your education, and the healthcare you have access to can all have positive or negative effects on your health. The best thing to do in order to maximize health for everyone would be to make health a human right. Declaring health as a human right would require the establishment of a baseline of health that would be provided to everyone by the government. In doing so, people would have more agency with their lives because they would not have to risk literally dying over their financial situation. There is a reason that health as a human right is a highly contested topic, especially here in the United States. It is because, over the past 40 years, the US has adopted a primarily neoliberal economic stance. According to the neoliberal belief, the economy is most efficient when industry has minimal trade barriers, minimal regulations, and minimal taxation. When the neoliberal economic philosophy calls for an unhindered free market, there should not be government subsidized healthcare, housing, education, or food because they would supposedly be inefficient and bad for the economy. This philosophy should theoretically result in better and cheaper services than the government could ever provide. However, using our healthcare industry as an example, in comparison to more socialist countries, this is not the case. According to this graph, it can be seen that U.S. healthcare expenditure far outweighs that of other countries, despite care in the U.S. being similar or even worse. While the U.S. spends the most on healthcare, we continue to have some of the highest obesity rates and lowest life expectancy compared to other developed nations. This is because healthcare in the U.S. is profit-driven as opposed to people-centered. It is clear that neoliberalism in the U.S. has led to further economic inequality and, as a result, health inequality. This is substantiated by the article Neoliberal Globalization and Health in a Time of Economic Crisis from the University of Michigan School of Public Health, which states, "The rise in income inequality has generally been detrimental to health improvements worldwide and accounted for a world life expectancy reduction of 2.52 years." In order to move closer to achieving health as a human right in the U.S., we need to accept that the neoliberal agenda cannot apply to health because health is a necessity. Ideally, this would mean strong government intervention in multiple sectors of the economy in order to provide everyone with free healthcare, baseline housing, education, and nourishment. The greatest changes would have to be in the healthcare industry because currently there is a lot of profit made off of healthcare in the form of care, insurance, and pharmaceutical drugs. These industries should all be federalized in order for care to be the least expensive for those who really need it. At a minimum, the U.S. should make a plan that can provide universal primary care to everyone. Adequate primary care could really help overall health because it is the closest tied to people in their communities. Primary care can help promote healthy lifestyles, prevent illness, and identify ailments before they get too severe and costly. While some aspects of the efficiency of neoliberalism may be true, we need to remove it from our healthcare, because companies should not profit from sickness. Making health a human right should become priority in the United States so everyone can lead a more happy and healthy lifestyle.